Okay, today's topic is the skeletal system. First, you can divide the skeleton into two main parts. You have the axial skeleton, which you can see in green. That's the skull, the ribs, the spine, and the sternum. And you have the appendicular skeleton, which are the limbs. Your limbs are basically your arms and legs, including your shoulders and your hips. And a way you can remember this is axial, meaning an axis. So that's where you see all of the bones of the axial skeleton are on that axis in the center of your body. Now, the function of your skeletal system is to provide a rigid framework. This rigid framework allows muscles to push and pull against in order to create movement. It also provides shape and structure to your body, and a big part of it is to support and protect your organs. What you might not know is that your skeletal system is also there to store minerals and to produce blood cells. So let's look at the structure of bones. It has a porous central cavity. That's where the blood vessels and nerve endings run through. And it's surrounded by a dense material called the periosteum. Now, breaking down the word like we always do. Okay. Breaking down the word like we always do, we've got peri and osteum. Osteum meaning bone, and peri meaning cover. So it literally translates to bone cover. And you can see that here. It is a tough, fibrous connective tissue. So here is different layers of the skull. You can see the scalp, which is the skin, epi meaning on top, and cranial meaning the cranium, your skull. So it's on top, and then aponeurosis. Apo means fat, neuro is nerve. And then you've got your periosteum that's here. That's right on top of the cranium. That's the bone, also called the skull. And then under the skull, you have the dura mater, which is another connective tissue which covers the brain. And you've got subarachnoid and arachnoid space. It's also part of the layering that covers the brain. Okay, just underneath the periosteum, you have compact bone. Long bones have both compact and spongy bone, which you can see here on the right-hand side. Compact bone is there to be very strong and rigid, and spongy bone, which you can see looks spongy, is there to absorb impact, absorb stress. Spongy bone is there to absorb stress from impact, which is why you can jump up and down and your bones just don't break. Okay, so let's have a closer look at the structure of compact bone. This allows your long bones, which is all the bones in your arms and your legs, to withstand stress. It's made of cylinders of mineral crystal and protein fibers called I can't talk today. Protein fibers called lamellae, which you see here. This is one osteon, which is a unit of compact bone. You can see it's got an osteocyte. Remember, cyte means cell, so osteo meaning bone, bone cell. And all the little, was it bluish purple, the little squigglies, that's the lamellae. In the middle, you have the Haversian canal, which is where blood vessels and nerve endings go through. So the Haversian canal is the center of each cylinder of compact bone. And like I said, the blood vessels and the nerves create a network that go through there, because all of the little dark spots that you see here, 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 here. These are osteocytes. These are living bone cells, and they need a supply of nutrients and oxygen. Okay, here's another micrograph of bone, and you can see the osteocytes that are embedded in these layers. Underneath the compact bone is spongy bone. You can see that quite clearly here. Compact bone, very thin layer that surrounds the spongy bone. And here is where you can see specifically how it's made to withstand stress by having a lot of these spikes. So spongy bone makes bones still hard and strong, but it makes them light because it has a lattice work structure. And like I said, those spikes, the trabeculae, they are along points of stress to help disperse the pressure. Now, in the center of long bones, you have what's called bone marrow. Bone marrow is a soft tissue. This is where blood cells are made. You have two types of bone marrow, red and yellow. Now, the red bone marrow is in the spongy bone, and it makes blood cells and platelets. The other kind is yellow marrow. This is in the shaft, or like the long part of the long bone. It's composed of mostly fat cells, and the function of that is energy storage, which is basically the function of fat anyway. But the cool thing about yellow bone marrow is that your body can convert it into red bone marrow if necessary. So what happens when a bone is injured? It's called a fracture. If circulation is maintained and the periosteum remains intact, healing will happen. However, I've never had a broken bone, knock on wood, but I know that if you do not have it, what do they call it? Set. If they don't set the bones, which means put them back in place, then it will heal in whatever position it's left in, which is why they give you a cast. Okay, so how does bone development? How does bone develop? Bone develops from cartilage. Remember I told you the outer part of your ear is cartilage? This occurs during the second month of fetal development, where the entire skeleton is made of cartilage. During the third month, the osteocytes start to develop, and they're going to release minerals that will stick in the spaces between the cartilage cells. This process is called ossification, literally the process of creating bone. Normal bone development depends on regular exercise and calcium and vitamin D. The amount of calcium needed per day on average is 1.3 grams or 1,300 milligrams, but most teenagers consume less than that. This can lead to smaller and lighter bones, which can lead to osteoporosis, which is this, because you lose bone mass. So remember, the skeleton is there to provide a rigid framework and also to support and give the body structure and shape. So if you lose bone mass, you start to hunch over like an old woman. Once the bones are formed, of course, when you are born, you are not at your maximum height. So we also have bone elongation. This occurs at what's called the epiphyseal plate, which you see highlighted by the arrows in the picture. These are columns of cartilage cells, and they're going to push the older cells toward the middle of the bones and be replaced by bone cells. When all the cartilage is replaced at the epiphyseal plate, that is when you reach your full height. And what's left are epiphyseal lines, which you see in that picture. Okay, next is joints. not that kind of joint. A joint is where two bones meet. There are three types based on how much movement is allowed. That's fixed, semi-movable, and movable. Fixed joints prevent movement. You find them in the skull. You see these are joints. Because yes, your skull is made of more than one bone. In fact, with newborn babies, there's a spot at the back of their head where the bones have not come together yet, because during natural childbirth, when the baby comes through the vagina, the head is literally squished. And sometimes, like very newborn babies, right after they come out, you'll see that their head's kind of pointy because it literally squishes their head to fit through the bones of the hip. And so then that's why you have to be very careful about the back of the baby's head. So there's a small amount of cartilage between. So between all of your joints, no matter what type it is, you always have to have cartilage, because cartilage is kind of like a squishy. You can feel your ears, kind of squishy, to prevent your bones scraping against each other, which would hurt. Semi-movable joints allow limited movement, like in your vertebrae and in your rib cage. So your rib cage allows some expansion, but it doesn't allow a whole lot of movement. And finally, we have movable joints, and we're going to have different classes of movable joints based on the type of movement that is allowed. And I'll go through each of those. So first is the hinge joint. You find this in your elbow and in your knee. You can see from the animation what kind of movement it allows. And they call it a hinge, just like the hinge of a door, which allows just back and forth movement. You have ball and socket, which is in your shoulders and in your hips. This is the freest of all the joints. It allows a full 360-degree movement. You have the pivot, which occurs between the two vertebrae at the top of your spine, which allows you to do no. You have the saddle joint, which looks like a saddle. That's why it's called the saddle joint. It's at the base of your thumb. This is what allows us to have what are called opposable thumbs, which are thumbs that can move in this direction. That's one of the big things that separates us from the apes. Apes can't do that. They can only move their thumb back and forth like this. They can't move it like that. So it allows us to do better grasping. And finally, we have, went right past that. Just went right past. Finally, we have the gliding joint, which occurs in the bones of your wrist here and in your foot. And I didn't have an animation, couldn't find that, but basically just kind of allows them to move like this, glide. Now, your joints are subjected to the most pressure and stress of any area in your body. So they are covered with cartilage. We also have ligaments that hold these two bones together. So ligament holds bone to bone. And finally, inside the joint, you have synovial fluid, which is secreted by the tissues of the joint. All of this is meant to cushion. The knee is the most susceptible to injury. You see here in the video that football player is literally slapping his kneecap back in place. The reason why the knee is so susceptible is because it carries all of your body weight, and your kneecap, which you can see here, is called the patella. And you can do an experiment if you want. You can sit on the edge of your chair and completely relax your legs. Like put them straight out and rest your heels on the floor. Make sure that both of your legs are relaxed, and you can take your hand and you can actually move your kneecap around, because it's literally floating on top of the joint between your femur, which is the top bone here, that is at the top of your leg, and the tibia, which is the big bone at the front of your lower leg. So it's literally just floating on top. It's attached, you can see here, by some tendons and ligament here. And you've got a whole bunch of other ligaments and tendons that are keeping the whole knee together. But this is the biggest injury that athletes have, is that they tear what's called their ACL. And I don't remember what AC stands for, but L is ligament, and that is a really, really bad thing because it completely destabilizes the knee joint. Okay, and I think one of the last, yeah, last thing is arthritis. That's what you see here. There's two kinds of arthritis. One is natural, just from old age, and your body just starts to break down, as all things do. And the other one is actually an autoimmune disease. So we'll start with that one. Rheumatoid arthritis is when your immune system attacks the cartilage, which is cushioning your joints. And you end up getting really painful, swollen joints, like you see here in the hand, where because the cartilage is being attacked, then you do end up having your finger bones, or depending on where the cartilage is being destroyed, where you have bone scraping against bone, and that is painful, and it causes swelling and inflammation like that. The other one, which is natural, is osteoarthritis. This is when the cartilage becomes thinner and rougher just due to old age.